Thank you very much, Madam Chair. It now gives me great pleasure to introduce our distinguished panelists, and again, thank them for being here. John Lott, the founder and the president of the Crime Prevention Research Center. Dr. Lott has held research or teaching positions at several academic institutions and was the chief economist at the United States Sentencing Commission during the 1988-1989. During 1988-1989, Dr. Lott is a frequent op-ed writer and a contributor to Fox News. Dr. Lott.
Thank you very much. Thank you very much, Chairwoman DeLauro and Ranking Member Cole and the other members of the committee. There's already massive resources that the federal government is giving to these types of issues. If you look on the 4 years from 2015 to 2018, over $42 million was given in grants to go and study firearms research type issues and there's many other resources, tens of millions of dollars from Michael Bloomberg. You have George Soros and others who put together the Fund for a Safer Future with starting off with $16 million. You have places like RAND, which are talking about having up to $50 million. You have many other areas. Plus, it kind of ignores how money comes from other areas. Professors, one of their main jobs is to go and do research. If you look over the period of time, only about 3% of medical journal articles were funded by federal grants. Only 15% got funding from any type of outside grant. The other 85% were done as part of their jobs as academics. There's a couple claims out there that I think are quite misleading. One is that research was decimated after the Dickey Amendment. That's simply not true. That claim comes from a report put out by Michael Bloomberg's, one of his gun control groups, where they claimed that in the years afterwards, there was a 60% drop in research. What they actually measured was firearms research in medical journals as a percent of all medical journal research. Research on firearms actually increased. What happened was that there was a massive explosion in medical research in other areas. Whole new areas of medicine were started. Whole new journals were started that didn't exist previously. So its share fell, but the absolute number of papers actually went up over that period of time. Another claim that we've heard frequently from a Journal of the American Medical Association is that if you look at federal resources being put into research on firearms, it pales in comparisons to mortalities when you compare it to other things. There are multiple problems with that. One is it ignores all this other funding. It ignores that for many areas of medical research, the primary way that research is done is through federal funding for cancer and other things. Those are very costly things to go and do. That's not necessary for most firearms-related research. And not only that, but you have the other way they measure it is papers published in medical journals. The problem is that's only a tiny fraction of the research on firearms. That completely ignores economists who have written on it. It completely ignores the entire area of criminology and all the journals that are there. I mean, you have dozens of criminology journals. Well, those aren't counted in those numbers. It ignores work done by law professors. And so those types of claims that we're underinvesting in firearms research only gets those numbers by completely missing massive areas of research that just are conveniently not counted in those types of numbers. The other problem that you have is simply the quality of public health research. And unfortunately, it's very poorly done. One of the most famous studies in public health is done by a person named Arthur Kellerman, where he has famously talked about the risks of having guns in the home. The problem is that one, there was a simple data problem. He simply assumed that if a gun death was owned in the home and somebody died from a gun death, it was that gun. In fact, about 86% of the deaths were from a weapon brought in from the outside, not the gun in the home. Fixing that one error reversed the results. The second problem that you have is just and this goes throughout public health research, is they use a technique that's useful for studying drug efficacy and apply it to social phenomena. It just doesn't apply because you can't control randomness in trials like you can in a drug trial. And so, for example, you go, I guess I have a discussion in my written research, you can look at that. But, you look at so many other areas of public health research, and they're like 30 years behind the time in terms of statistics. The types of controls that they make are just not up to par with other areas of research. And so much money is wasted in this. I could go and point out, you see grants for $300,000 to go and put together a database on mass public shootings. Do you know how many databases are already out there on mass public shootings? I don't even know how you spend money on something like that. Or $600,000 to go and look at state laws and correlate that with homicides or suicides. I mean, this is trivial. You have an 8-page paper that comes out of a $600,000 grant. I mean, it's almost criminal the way federal resources are wasted and thrown away. I mean, and that just is only part of the problem that's there. But I greatly appreciate the time that you have there. This is an important problem. Lives are at stake. And it's important that we don't waste resources, valuable resources, on studies that don't add anything to our knowledge.
Ranking Member Cole.
Thank you very much, Madam Chair. And I want to thank all of you just again for your testimony and what you presented. I found it very interesting. Now, you obviously don't always agree. I mean, I happened to read back to back, Dr. Lott, your paper, and then Dr. Morrell, your paper, and you guys have very different views on the amount of available research. And so I want to give you both an opportunity to address that. How much research do we have in the private arena out there? How readily available is it? And how robust is it going forward? So I'll go first with you, Dr. Morrell, and then Dr. Lott.
Thank you, Ranking Member Cole. We just completed a review of a huge amount of literature, trying to look at what evidence is available. High quality evidence we were looking for in particular, meaning evidence that can really say something about the causal effect of the policies we were looking at. And the big takeaway from our study was that there's the vast majority of the effects we were looking for evidence on, we couldn't find research on. So I think that that's some evidence that there's more work to be done for sure. And I think that Dr. Lott's own research that he reported, which says that only 3% of the firearms research he was able to identify had any federal funding. You could look at that and say, great, we don't have to have federal funding for any research. But I think the other side of it is the real story there is that the only research that can get done is research that doesn't cost anything, that doesn't cost much.
Dr. Lott?
I've done some of the largest studies that have been done on crime. I think my book, More Guns, Less Crime, from the University of Chicago Press. I don't know of any other one that's looked at city, county, state level data in the many different ways that I've looked at, even come close. But, he talks about the lack of studies. You look at his work on right to carry laws. They literally ignored dozens of peer-reviewed studies that have been published on concealed carry laws. I suppose if you ignore a lot of the work that's there, it'll make it look like, in fact, there's not as much done. They do that in other areas, such as on background checks and on other things that are mentioned. So, I look at it and there's a tremendous amount of work that's being done. You got to count criminology and others and these claims that have been made about not enough research, looking at the Journal of the American Medical Association article. You have to count all the other funding sources. And I've never had to go, even though I've done the largest studies, I've never had to go and ask for federal money. You have a lot of data there. You can go and hire people on your own through grants through the university that you're working in. I've been at Stanford, the Wharton Business School, Yale University, University of Chicago, And I never had any problem getting money to go and do the research that I wanted to do. And without a dime, not even a penny of federal money that's there. The problem that you have with federal money is that it's often political in terms of who they give it out to, politicians and the people who make those decisions. I just don't think can divorce politics from it. And beyond that, the money is just tremendously wasted. I mean, I look at studies, there's funding for $600,000 that just got out to look at mass public shootings.
If I can, I'm going to hold you
Sure,
there.
I'm sorry.
No.
Congresswoman Lee.
Thank you very much, Madam Chair. I want to thank yourself and our ranking member for this very important hearing. Because in my community, like in many communities, it has been a public health emergency for years and years and years. Let me take a moment to acknowledge, of course, our young people who are here, because they are bearing witness to, and here on behalf of those who have been killed or injured by gun violence, and also for using your voice and your presence to prevent future senseless acts of gun violence and tragedy. So thank you all very much for being here. Let me say a couple of things. First of all, gun violence disproportionately impacts communities of color, people of color. A couple of statistics. In 2017, 50% of gun-related deaths in our country were African-American men, even though African-American men make up about 6% of the country's population. 4 in 10 African Americans have been personally affected by gun violence, including my own family. But the majority of African Americans do not feel as though their calls to end gun violence and formally study it, that the impacts are being heard by the public. Now, in my own district, for example, I hear from constituents every day about the effects of gun violence. 400 people in my district were killed in the last 5 years alone. There have been 3 weekends this year where 3 or more people were killed by guns in my district. Unfortunately, we don't hear about what is taking place in many communities and what we're dealing with on a daily basis. Now, I wanted to ask you, and probably Dr. Stewart, you may be the appropriate witness, and thank all of you for being here to respond to this, but I am a psychiatric social worker by profession. I understand PTSD. I know the signs of PTSD. I go into a variety of communities in my district and talk to individuals in the community who have been affected by gun violence. The signs of PTSD, not only from individuals, but from the community, there is a community PSD crisis. And I'm wondering how we're addressing PSD with individuals and with communities. I mean, I can cite census tracts where everybody has been affected by PTSD because of the gun violence that takes place over and over and over again. And I know we've done a lot of research on PTSD in the military, but I'm wondering in terms of funding, a dedicated stream of funding, federal funding to better understand the public health epidemic of gun violence, how we can factor in, and what do you think we need to do about PTSD that is rampant in so many communities across the country?
So,
The long-term trauma impact, Dr. Lott?
yeah, no, I really appreciate your question. To me, too much is focused on the guns per se and not what's underlying causing it. Over 50% of the murders in the United States occur in 2% of the counties. And if you look in those counties, 10 blocks in those counties account for most of the murders in those areas. It's gang violence. It's basically drug gang violence. What you have to do is figure out a way of taking away the incentives for people to go and join those gangs that are there. And, you know, because just to focus on guns, you're going to be as successful in stopping these gangs from getting guns as we've been in stopping them from getting drugs, okay? I mean, you look at Mexico, they have one gun store in the country since 1972. The most powerful guns you can legally buy or own are 22 short-run rifle, and yet they have a murder rate that's 5 times higher than what we have because the gangs, the drug gangs, bring it in. What you have to do is think of ways of taking away the profits that the drug gangs have. And we can talk about that, but that's a completely different conversation than the
Sure, but this still is a public health emergency, and what we need to do is figure out how we can do the research to document that this is a public health emergency, and then develop strategies on how to.
The point is the gangs, and that will reduce their incentive for bringing in the guns to protect their valuable drugs and other things that they have.
Dr. Lott, please. Thank you. Congresswoman Frankel.
Question. There are two general points I would make. One is, I think we need to move a little bit away from the focus on firearms and talk about what creates the incentives for people to go and use them the way they do, and to talk about what can you do to eliminate the profits that are involved in gang violence and in drug gangs. Because if you focus on the guns, you're going to be as successful in stopping these drug gangs from getting a hold of guns as you've been in stopping them from getting a hold of drugs. We spent huge amounts of resources to try to stop these drug gangs from getting a hold of drugs. It's not like a drug gang can go to the police and say, this other gang stole our drugs, can you help us get them back? They have to set up their own militaries. If I could click my fingers today and cause all illegal drugs to disappear from the United States and all guns, how long would it take for illegal drugs to start coming back into the United States? If you're in El Paso, 20 minutes? How long would it take for them to bring the weapons in to go and protect that valuable property that's there? They'd be bringing them in exactly at the same time. It's no more difficult for them to, just look at Mexico, as I was saying, it's no more difficult for them to go and bring in the drugs or the guns. So to me, the big focus is what creates the incentives for them to engage in this violence, which is so heavily concentrated in the urban areas, in these small areas within our country.
I yield back.
Thank you, Madam Chair, and thank you to our panel for being here. I was across the hall at another hearing, and so that is why I came in late. And the reason I came over here was because I got a text to me saying that right now, as we sit here, there is an active shooter in my part of the state of Illinois, in Rockford, Illinois. I share the representation of this town and the county, Winnebago County, with Congressman Adam Kinzinger, and we are in constant communication right now. But I wanted to come over here knowing what the topic of this conversation is. Let me just tell you what happened. So this is in the northern part of the state of Illinois. So it's the farthest northeast part of the congressional district that I serve. And there's an active shooter right now. What happened was a law enforcement officer went to serve a warrant, and the initial reports are this man who was armed shot through the door and shot the law enforcement officer. I don't know how the law enforcement officer is doing right now. We have some preliminary reports, but it would be irresponsible of me to say exactly what his condition is. So this shooter is now on the loose. So everybody in our community is being warned about how he is armed and dangerous. And, these kind of stories, everybody sitting up here, everybody sitting out there knows of these kind of stories and just the imminent threat, and you just never know when these things are going to hit. And I just cannot imagine the fact that the Centers for Disease Control and Prevention hasn't invested more resources to get to the bottom of this. Congresswoman Clark hit on those issues and the importance, and I appreciate you drilling down, and Dr. Morale, I appreciate your answer to that. But I'm going to be going home to my congressional district to meet with folks, and I'm just wondering, as we sit here, this is going on, and things are going on, I'm sure, in other communities right now as well. But it just is really hitting home right now. Your message to people who I represent in Illinois, and any one of you can address this.
Forbid that the officer ends up dying in this tragedy. But one thing that's interesting is that 90% of the people who commit murder have a past violent criminal history. This is not something that your typical person goes and does. And that obviously suggests certain responses. But the notion of mental health, I wish it was that simple. Over half the mass public shooters in the last 20 years were actually seeing mental health care professionals in the year prior to their attack. And in not one single case were those individuals identified as either a danger to themselves or others. So, the question becomes, it'd be great. I'm all for trying to treat mental health and things like that. But the notion that somehow you're going to be able to go and identify these individuals beforehand. One is people with mental health issues are significantly less violent on average than the general population. And people with mental health issues are also much more likely to be victims of violence than the general population. And so you're talking about people who engage in violence at such low rates. There's a whole academic literature about the inability for mental health care professionals to go and identify people who are a danger to others. They realize themselves in the profession the difficulties that they have. If the issue here turns out to be a criminal who is being served a warrant there, unfortunately, as I say, the vast majority of murders here are people who already have a violent criminal history, and probably was illegal for the individual to own a gun to begin with.
Thank you, Madam Chair.
What we're going to do is to look toward the closing comments. I'm going to ask the Ranking Member Cole if he has any further comments to make before we draw and I will make some closing comments, and then we will draw the hearing to a close.
Thank you very much, Madam Chair. And I want to thank all of our witnesses here. I really found the discussion exceptionally useful, and certainly the materials that you all produced extremely useful as well as a sort of prep for this. It's been a good discussion. It's been robust. I suppose one of the concerns I have here, and I'm going to draw actually something from a memo that was prepared for me, not by any of these gentlemen coming in. And it says the public health push for banning guns goes back to the late 1980s. In a 1989 issue of the Journal of American Medical Association, Center for Disease Control official Patrick O'Carroll stated, quote, "We're going to systematically build a case that owning firearms causes death. We're doing the most we can do given the political realities," unquote. I would suspect that probably did more damage to the cause of legitimate gun violence research than probably any single statement in modern history. And it goes back to a point that Mr. Morrell made. In some cases, predisposition of the researcher can impact at least the conclusions. And you would hope an honest researcher, and I know all of you are, and I think most researchers are, just follows the data to where it takes them. As opposed to saying, I've already got my conclusion, now we're going to build a case to support my conclusion. It's the exact opposite of what good science ought to be. But I think you've shown a lot of areas where we could move ahead, I think, on common ground. And I frankly like the idea of sort of keeping the Dickey Amendment as a guardrail, because, again, that doesn't prohibit research. And I would hope, frankly, the members or the people at NIH and CDC who've been given a lot of signals, both in report language and by statements by the secretary. If you've got some legitimate ideas, go out there and do it. We're not trying to stop you from researching. And we certainly, certainly this subcommittee, has not done anything to try and discourage that. Quite the opposite. I mean, this subcommittee, for the first time in a dozen years, started putting significant resources back into NIH and back into CDC. We were flat funded for 12 years under both Republicans and Democrats. And that has not been the case the last 4 years, and I'm pretty certain it won't be the case going forward. We have a bipartisan commitment here. So resources are available. We'll have our discussion over whether or not we should direct it. I think that's a legitimate discussion. And there's some dangers there. We're pretty careful about trying to let researchers decide what the areas of research make sense, and let scientists decide which avenues of inquiry are important. We don't want to impede them. Quite the opposite. And again, that's why the statements were made in the record, because I do think there has been some confusion here that hopefully the secretary's cleared up. Hopefully this subcommittee working in a bipartisan fashion has cleared up, and we'll continue to work on that going forward. So, but there are persistent concerns, and this doesn't just apply to this politically sensitive area, as to, do you adopt policies that seem on their surface to make sense and then get the opposite reduction? There was a time in our country's history we decided, gosh, drinking is a really bad thing, and it is. And over drinking is terrible, and it is. And so let's try prohibition, and we did, and it didn't work very well. It didn't solve the problem; it exacerbated the problem. I think Dr. Lott made a very good point when he talked about the strength of gun laws in Mexico, the laws and what you could buy, and then what the reality on the ground is. We know, that's frankly, we have a great deal of responsibility, in my view, there, because we're the market. I've talked to the president of Mexico before about violence inside his country and all the thousands of deaths, and he literally said, maybe you should legalize drugs in your country. I would never do that here, but this is a previous president, by the way, not one that's there now. He said, but your inability to control your consumption is killing us down here, because we don't have the resources to police in the way as robustly as you do. So the production comes down here, smuggled across your border. You have some responsibility for that. I thought that was a very fair point to make. But it also pointed out that the problems were cultural, they were economic, they were complex. They had to do with addiction and all sorts of behavior that's inappropriate. Again, Dr. Lott's point about 50% of the murders in 2% of the counties is pretty staggering. And probably usually in counties that have pretty strict gun control laws. So we clearly have a whole complex of problems here that demand research, and hopefully this subcommittee will be in a position to continue to robustly fund that research and widen it out in ways that help us get answers. And hopefully we don't jump to policy conclusions before that research is actually completed. So again, I want to thank all of you. I thought this was, again, a terrific session. I want to thank you for the expertise and the passion. We had a couple of, this almost was like I used to be an academic. It's almost like being back on a college campus again, because we had some great debate too, particularly at both ends of the table over some of these things. But it was helpful debate. It was good debate. It was civil debate. So, Madam Chairman, thank you very much, and enjoyed being here and enjoyed hearing our witnesses, and look forward to working on this issue with you as we go forward.
Thank you very